almost a year ago, actually, in a few weeks. I came in because I suffer from asthma. So I was feeling really short out of breath and stuff. I came to the hospital with that mentality that I'll probably be home by the morning. So when they told me that I had COVID and that they were gonna keep me in here, but I was just shocked because I never expected me to get it. That was a Thursday night going into Friday. Sunday morning, they come and talk to me. They're like, yo, your oxygen is not going up. You're pretty bad. You need to get intubated.
He was so sick. I remember some of the text messages he was sending his family and his friends, and his intubation wasn't easy either. It was really tough. I'm so proud of him because I remember telling him, you're gonna have to fight if you wanna live. I remember. Yeah, I told him, you've got to fight.
Actually, I was in the shower. All of a sudden, I just couldn't breathe. Yeah, it was scary. I was having a really tough time. So we called 911 and they brought me to John Muir. And I had pulmonary embolisms in both legs and both lungs. I guess it was a life and death situation. When they told my son, we don't know if she'll make it through the night.
When we admit a patient who comes in, it's like everybody kind of just swarms on that patient. There's like a team of nurses who come in, there's an intensivist who comes in, there's so many different eyes on that patient, and being able to call in any person that is necessary to meet the demands of that patient as their demands are evolving and changing.
My mom, she went in a few days before I did. She tested positive as well. And the hardest part is knowing that your mom is 2 doors away from you, fighting the same battle as you.
I remember how scared his mother was too, and he was worried about his mother. I mean, the two of them, they were doors apart. There would be like a code blue over the speaker system. His mother would be like, is that my son?
My mom was the sickest patient here. Both of her lungs collapsed while being intubated. At one time, she had about 14 medicines going just to keep her alive. They went through a lot just with me. I could even imagine what they went through with my mom. They never gave up.
I mean, I was in a life and death situation, right? It was critical that whatever doctor I had made the right decisions to do the right procedure and save my life. But, you know, honest to God, it's so crazy because one would think you'd be scared to death, and I wasn't. They were confident that what they were doing was going to work, and if they were confident, it made me confident. I was just so at ease that I wasn't scared at all.
I recognize that sometimes our job is to be with people on the worst day of their lives, and that the things that we say and the things that we do can have a lasting impact on them and their families. We do it naturally, and we do it because we care about the patients that we serve and the families that we serve, but we also care about each other as coworkers and as colleagues.
It means that you have a village taking care of you. Everybody's involved, everybody cares deeply. We all just want the best for our patients, truly.
COVID is something that I do not wish on nobody. So thank you for everything you guys did for me and my mom. I will forever be grateful. You guys did an amazing job.
That's so satisfying to see somebody have such a remarkable change and get so much better. And I just love it when people graduate out of the ICU. It means we're doing what we're supposed to and people are getting better, and that's what it's all about.
I lived with them for 19 days, and you know, it's a very personal experience, you know, when you're in ICU. One of the nurses, his name is Mark Jan, and every morning he would bring me coffee. He knew exactly what I liked, and he knew what I liked in my coffee. And the morning I was leaving, he came to tell me, well, guess, good news, you're gonna be leaving us. I said, oh no. He said, yes. I said, when? He said, right now. And I said, oh, you can't do that. And he said, why? I said, I haven't had my coffee. So I loved them. I mean, they were beyond wonderful. So
I think it's important for the community to know that the medical intensive care unit is there for them on their sickest of sick days. But we're there, and that's what we're there for.